Hello friends, welcome to the session in the elective course module on modern medicine. In this session, we are going to take an overview of education in modern medicine. You will learn about evolution of modern medicine education and you will get sensitized to the new competency based undergraduate curriculum of National Medical Commission India. Through this module, you will be able to pick up relevant concepts which you may be able to incorporate in your homeopathy education. What are the session's objective? At the end of this session, you as student of first year homeopathy shall be able to describe the history of education in modern medicine, describe the concept of outcome based and competency based medical education, enumerate the key components of modern medicine curriculum related to teaching learning, describe the concept of early clinical exposure and its relevance to homeopathy education, understand adult learning principles and how you can take responsibility for your own learning with the help of objectives, self-learning and peer learning in small groups. Enumerate key principles of the assessment in modern medicine curriculum. Able to receive feedback from teachers on your own learning and able to ask for support for your learning difficulties. Let us start with the history of education in modern medicine. In this section, we will see how education in modern medicine evolved over last few centuries in our country. This journey is definitely interesting and tells us about the impact of Western world on medical education in India. Entry of Western or modern medicine in India. Portuguese first introduced Western medicine into India in the 16th century. East India Company's medical officers who came in the first fleet of ships also brought Western medicine in India in 1600. Hospital boards were constituted, which comprised the Surgeon General and Physician General in 1775. Medical departments looking after military personnel and British civilians were set up in Bengal, Madras and Bombay presidencies in 1785. Medical department in the three presidencies were amalgamated into Indian Medical Service in 1869. Let us see how entry of Britishers influenced modern medicine education in India. A new beginning to medical education in India started in 1835 with the establishment of Calcutta Medical College. This first medical college was founded on the basis of European model with English as a medium of instruction. Later in the same year, medical school was established in Madras to afford better means of instruction in medicine and surgery to the Indo-British and native youths entering the medical branch of the service in the presidency. Grand Medical College Mumbai was founded in 1843. The aim was to impart benefits of medical instructions to the natives of Western India through a systematic approach. The journey of modern medicine education in India began with the subjects of anatomy, materia medica, medicine and surgery were covered in 2 years course. Chemistry, physiology, midwifery and ophthalmology were added later and the duration of the course was spread over 3 years. In 1875, Madras Medical College admitted women students for the first time in India. The Indian Medical Degrees Act was passed in 1916. Later in the due course, other subjects from modern medicine were added and the undergraduate course was framed for 4.5 years with 1 year of compulsory rotating internship. It will be interesting to know how the evolution of teaching learning methods occurred over the decade in modern medicine education. In olden days, the Socratic method was commonly practiced. The method involved learning through an open-ended questions to the students or student asking questions to the teachers. Later, classroom method was adopted in our country. It is a teacher-centric method using instruction as a medium to the masses. Apprenticeship model evolved in modern medicine in which individual supervision of students to achieve learning was planned by the teacher. It was very recently that competency-based model was adopted by Medical Council of India. It is a student-centric, domain-based, small group teaching with focus on students' engagement. CBME curriculum is being implemented in India for modern medicine from 2019 MBBS batch. In this section, we will learn concept of outcome-based and competency-based medical education. Why there was a need to change curriculum of modern medicine? There were several issues with traditional curriculum. The MBBS graduate teaching was more focused on knowledge component. Lesser emphasis was given to the psychomotor skills. There was no formal training for attitude and communication. The outcome of the course were variable and not clearly defined. The traditional curriculum was not aligned with societal needs. The MBBS graduate, after 5.5 years of training, was not competent and confident to practically implement theory learning in real-life scenarios. For example, MBBS student who has theory knowledge of structure and functioning of heart, diseases of heart, investigations and treatment of heart condition, if had to practically treat a patient of acute heart attack, will he or she show the ability to treat such patient? Unfortunately, the answer was negative most of the time. This resulted in a gap which needs to be addressed through curriculum revamping. Competency-based medical education, CBME, which is successfully run in various international universities, was adopted in our country from 2019 by Medical Council of India. CBME is an outcome-based approach to the design, implementation, assessment and evaluation of a medical education program using an organized framework of competencies. What is competency? Competency is an observable ability of a health professional integrating multiple components like knowledge, skills, attitudes, and values. In other words, what should you be able to do as a graduate of your field, or what should have changed in knowledge, skills, attitude, and communication skills of a graduate due to learning. Thus, competencies are generalized or broad statements from which teacher derives specific learning objectives. In contrast to competencies, objectives or outcomes are specific. Objectives are clear statements regarding what you as a learner will be able to do at the end of a learning period, which you could not do before. What you should know, do, or the way you behave. Thus, to achieve a single competency, there might be several specific learning objectives related to knowledge, application of knowledge, learning the skills with ability to show how to perform a skill, and attitudinal aspect related to effective communication and ethical professional behavior. Let us take an example of approach to a patient with pain in abdomen. Undergraduate students may know anatomy and physiology of structures in the abdominal cavity. Students may know various disease conditions which can cause abdominal pain. Students may know how to examine abdominal system correctly, may also know the list of investigations and all aspects of drugs to diagnose and treat that pain. But if student does not know how to treat a given patient of abdominal pain, the learning he received are not meaningful. It is also essential that he shows empathy towards the patient with abdominal pain. We have learned that what is competency. There are two other related terminologies you should be aware. Competent, student possessing required abilities in all domains in a certain context at a defined stage of medical education or practice. Competence, habitual and judicious use of communication, knowledge, technical skills, clinical reasoning, emotions, values and reflection in daily practice for the benefit of individual and community being served. In other words, competency is what to be done, competent is one who can do it, and competence is what one does. Traditional curriculum revolve around educational objectives. In contrast, competency-based medical education takes into account health needs of the society and existing health system. From these needs, competencies are defined and objectives are derived. Thus, the curriculum is outcome-based and has assessment which is competency-based. If we compare the two curricula, it is clear that competency-based curriculum is outcome-oriented, gives emphasis on application of acquired knowledge, it is student-centric, responsibility of the contents lies with both the teacher and student, assessment is formative, meaning multiple times, it is objective authentic with direct observation, and it is criterion based. Such an educational program can end at variable time depending upon the time when competencies are achieved. CBME curriculum has identified 5 roles of Indian medical graduate, namely clinician, leader and member of healthcare team, communicator, lifelong learner and professional. Clinician who understands and provides preventive, promotive, curative, palliative and holistic care with compassion. Leader and member of healthcare team and system with capabilities to collect, analyze, synthesize and communicate health data appropriately. Communicator with patients, families, colleagues and community committed to continuous improvement of skills and knowledge. Lifelong learner committed to the continuous improvement of skills and knowledge. Professional who is committed to excellence, is ethical, responsive and accountable to patients, community and profession. Very recently, for 2023 batch onwards, 2 more roles have been added. They are critical thinker who demonstrates problem solving skills in professional practice and researcher who generates and interprets evidence. Healthcare delivery has goals. To meet that goals, graduates have to perform many roles. To perform those roles, they need certain competencies. To attain those competencies, they need to meet certain objectives. Obviously, this entire process needs ongoing monitoring. Let us now get sensitized to the key components of competency-based curriculum related to teaching learning. As per Graduate Medical Education Regulations 2019, the new curriculum was rolled over since 2019 MBBS batch. All the modules related to curriculum are available on the website of National Medical Commission. The key components of competency-based curriculum are foundation course, early clinical exposure, skills training, integrated teaching, attitude, ethics, communication that is ATCOM module, electives, pandemic module, self-directed learning, student-doctor method of clinical learning, family adoption program, internal assessment, competency-based formative and summative assessment. Let us go through some of the concepts which may be useful to you as a homeopathy student. Foundation course. It is a mandatory program in the very beginning of undergraduate education. It consists of orientation to modern medicine, skills module, field visit to community health center, professional development including ethics, sports and extracurricular activities including enhancement of language or computer skills. This course is conducted in the first 2 weeks of first MBBS. Skills acquisition through Skills Lab is an integral part of CBME curriculum. Each medical college must have a Skills Lab as per guidelines by NMC. Skills Lab is used for teaching learning and also for assessment. The identified certifiable procedural skills should be acquired by students and competence has to be developed as performed independently, demonstrated or observed on real patients or standardized patients, mannequin or in laboratory setup. Newer teaching strategies such as alignment of the specific learning objectives within a phase or a year or integration of SLOs across all phases and all subjects is done for better understanding of the topics or subjects with clinical relevance and applied knowledge. Following the adult learning principles, the curriculum has components of self-directed learning, that is SDL, with predefined hours in all subjects across all phases. Teachers do guide students in SDL. This makes the curriculum student-centric. To provide learners with experience in longitudinal patient care, being part of the healthcare team and hands-on care of patients in outpatient and inpatient settings, student-learner or student-doctor method of the learning is adopted in competency-based curriculum. The focus of this method escalates across 4 phases. In the phase which is first phase, focuses on introduction to hospital environment, early clinical exposure and understanding perspective of illness. In the second phase, it is history taking, physical examination, with assessment of change in the clinical status and communication including patient education. The third phase additionally focuses on choice of investigations and basic procedures with continuity of care. In addition to all above, phase 4 focuses on decision making, management and outcome. Thus, the clinical competence teaching of medical student is escalated throughout the MBBS course. ATCOM, Attitude, Ethics and Communication module in modern medicine curriculum focuses on most neglected part of the MBBS curriculum, that is development of soft skills right from the formative years. It focuses on importance of effective communication, sensitizes students about key bioethics principles and imbibes the values related to professionalism. This module has year-wise sections. Competencies and objectives are clearly defined related to learning and assessment of these skills in all subjects across all phases. Friends, what we have done so far is we saw what was the need of change in the medical curriculum, how the modern medicine had an impact in our country, and also we saw various aspects of change in the curriculum throughout the last few decades. We also saw key components of important aspects of competency-based medical education. We learned what is competency, what is competence, and what is competent. With this, we also learned few aspects of important related things which are there in the new modern medicine curriculum. Friends, we are going to learn some important new aspects of the modern medicine curriculum. You also have electives and currently you are undergoing those electives. Similar to what you have electives, students from modern medicine also have electives in the third professional year. What is elective? Learning experience created in the curriculum to provide an opportunity for the learner to explore, discover and experience areas of interest in the profession. It is a brief course made available to the learner during undergraduate study period. Electives has two blocks. Block 1, that is pre-selected preclinical or paraclinical and other basic science laboratories. Block 2 is a clinical department including specialties, super specialties. Students can choose from available options depending upon their interest and career preferences. What are the advantages of electives? Electives allow flexibility and choice during study period. It gives opportunity to explore interest areas to supplement future study. It develops self-directed learning skills. It's an opportunity for direct experience of working in interested areas. It develops deep learning and critical thinking through reflections. It has a student-centric component in curriculum and identifies career path by direct experiences. In this part of the session, we are going to learn about the newer concepts of early clinical exposure, ECE, and its relevance to homeopathy education. ECE is a teaching learning methodology which fosters exposure of the medical student to patients as early as first year of medical college. How early? What would have been traditionally been regarded as a preclinical phase, usually the first year. What exposure? Authentic human contact in a social or clinical context that enhances learning of health, illness or disease and the role of health professional. You all must be learning basic sciences such as anatomy, physiology and biochemistry in your first year. At times, you may be wondering why to learn these subjects. Are these subjects or topics clinically relevant to me in future? How can I apply the basic sciences knowledge in future? You have homeopathic repertory and case taking as one of the first year subjects. You may be thinking, why should I add burden of clinical understanding so early in my professional journey? Why to have early clinical exposure? These questions must be coming to your mind. But friends, early clinical exposure helps students to learn basic clinical skill early in their professional journey. It enhances your motivation and prepares you towards the purpose for which you enter this profession. It enables students to correlate what they are learning in basic sciences by learning basic clinical skills and observing relevant disease abnormalities. ECE encourages students to learn the professional behavior of a doctor by observing and being mentored by a clinical teacher and provides the context for application of your learning in actual practice. What are the salient principles of ECE? ECE provides a clinical context ensuring patient centricity. Clinical context can include case scenario, videos, actual patient, simulated patient, etc. The presence of actual patient in every session of ECE, though not essential, is preferred. Therefore, ECE is exposure to relevant clinical context in earlier years. Purpose of ECE is not to prepare the conventional clinical teaching, but to provide better understanding of basic sciences through a clinical context. What are elements of ECE? They are basic science correlation, to apply and correlate principles of basic science as they relate to the care of patient. Clinical skills, to include basic skills in interviewing the patient, doctor-patient communication, ethics and professionalism, critical thinking and analysis, and self-learning. Humanities, to introduce learner to a broader understanding of socio-economic framework and cultural context within which health is delivered through a study of humanities and social sciences. Where and when to use early clinical exposure? Early clinical exposure is used for training in basic clinical skills and demonstration of clinical cases with context and relevance. Classroom setting. Clinical case discussions or patient is brought to the classroom. Hospital setting. Hospital OPD visits or visit to primary health center. Community setting. Community visit, rural setup or urban area. Let us now see the advantages of ECE in teaching learning. ECE helps students to meet intended learning outcomes. It helps in developing an understanding of how symptoms can be explained by underlying anatomic, physiologic changes. ECE encourages students to move from knows to knows how, that is application of knowledge. It allows students to correlate anatomy, physiology and biochemistry with the signs and symptoms of a disease. Students' understanding of utility of basic sciences in patient care improves. It helps students to look at a person having the disease rather than just disease itself. So it thus provides the holistic approach. As an adult, we learn differently. There is a major role of self-learning and learning with your own peers. Apart from large classroom traditional teaching, small group teaching is an integral part of adult learning. Hence, let's understand adult learning principles and their relevance in your learning process in this section. Friends, it is interesting to learn how our development occurs from novice to expert in our professional educational journey. After completing your higher secondary education, you are entering into homeopathy to be professional of tomorrow. You are novice to the knowledge, skills and attitude related to homeopathy. Through the training during formative years, when you are advanced beginner, you gain required knowledge and skills. Your goal is to become competent homeopath. Through your internship, specialization or early clinical practice, you become proficient in your field. Through years of clinical practice, you become an expert homeopath. Each milestone is thus important in your professional journey. Do you know how much knowledge we retain after learning? You may be surprised to see these figures. 20% of what we hear, 30% of what we see, 50% of what we hear and see, 70% of what we hear, see and say, and 90% what we see, what we hear, what we say and do. So, it is clear that just gaining theory knowledge is not enough. Application of this knowledge in real life scenarios by observing, narrating, reflecting and practically doing is very important. Friends, learning is a continuous process. It does not end after school or college days. We adults continue to learn new knowledge and skills throughout our life. Learning is associated with taking new roles and tasks in communities and at place of work. We keep learning in a spiral manner. It is a cascade of events. By doing a task, we are having an experiential learning. The knowledge of skills learnt gets registered and our brain further analyzes that knowledge. We need to reflect on these experiences by developing reflective writing practices which help us to improve further by applying the learning in a similar other context. During each such learning, a new experience are generated and which in turn makes us learn further. We adults learn best when we feel valued and respected. The learning experience is enjoyable when it's active and fulfilling our needs. When we accept responsibility of our own learning, when our learning is self-directed and meaningful to us, we learn the most of it. When our learning addresses ideas, feelings and actions, we feel satisfied and interest enhances in further learning. The learning experience is fruitful when the new material is related to what we know. The conducive training environment is also equally important. Learning which is reinforced and has immediate applications in real life is always enjoyable. When learning occurs in small groups and the trainer values each student's contributions, the best is achieved in teaching learning process. In the next few slides, we are going to learn these adult learning principles. Safe, non-threatening environment. Adults while learning look for safe environment for experimentation and practice with new information and skills. Comfort, good health, uninterrupted sensory inputs and flexibility in learning are also equally important. Learner, an active contributor. You do not like to be spoon-fed. Teacher's role should be to initiate and sensitize the topic. Learning is best when the adults are given opportunity to express. If questioning is allowed by teachers in a non-threatening environment, adults learner contribute in teaching learning process. Build on existing knowledge. As an adult, you have a capacity to think and write. Build on your prior knowledge. Adults learners builds on and values existing perspective, knowledge and skills. Relevant contents. New information and skills are relevant to the workplace and communities. Opportunities are available to apply knowledge and skills immediately. Learners are motivated to learn new tasks and roles. Participatory. Learners are actively engaged in learning process. Creates opportunities to practice applying new knowledge and skills. Problem-centered approach. An overview with the objective is provided. Each new content needs to be related to previous ones. Rather than just theory, the practical application with real-life scenarios is essential. Support for self-directed learning. Learners receive positive reinforcement such as praise and encouragement. Learners take up responsibility for what they want to learn. Learners are active participants in their learning process. During a course, learners moves from dependent to self-directed learner. Learners receive constructive feedback to help them improve their knowledge and skills. Constructive feedback. Though last, it is one of the most important aspects of adult learning. We will elaborate on the role of feedback in our education as an adult learner. Assessment is very important in any curriculum. Friends, do you look at assessment as a learning tool? You will all agree that assessment drives you learning. It is a general tendency of all students to skip whatever is not assessed. This figure tells you about various assessment methods which we use in modern medicine education. Many of these methods must be relevant to you in your homeopathy education. The method depends upon which domain of learning is to be assessed. In this example related to assessment of communication skills, the assessment method is depending on attributes of communication skills to be assessed. Assessment in modern medicine curriculum. We just saw how assessment methods depend on learning outcomes or goals. Purpose of assessment is twofolded: to gather evidence to provide feedback about learning to the learner and instructor, and to use the evidence for learning to make judgments by allotting marks and rating the student. There are two types of assessment. Formative assessment, assessment for learning, is the improvement or growth. Feedback is vital element of this assessment. It is undertaken during the learning process. Summative assessment is for decision making of pass or fail, for a judgment or a verdict, and is undertaken at the end of learning process. In the new competency-based curriculum of modern medicine, passing in internal assessment is a separate eligibility criteria for appearing for summative assessment. Dear friends, now we are going to discuss last but one of the most important aspect of this session, and that relates to seeking feedback and asking for support. As students of first year homeopathy, you should understand that each one of you may have different capacity to learn. In the crucial formative years, it is possible that you are unable to cope up with the situation or stress, including the learning of homeopathy itself. It is very essential to obtain feedback about your performance, and you need to approach your teachers for the same. If you get feedback about your performance at the end of the academic year or at the end of your homeopathy education, it may be that it is too late. You need to take feedback periodically, as frequently as possible. It is not that you will seek feedback only from your teachers. Your own friends, senior batch students, faculty mentors, and other members of healthcare team can give you feedback. Along with this journey of homeopathy education, your patients and caretakers are also going to give you feedback about your performance. You should approach for feedback not only for the knowledge part but also for the skills and your attitude. Reflecting on the feedback received from your multiple team members multiple times during formative years and acting upon the lacunae is the key to succeed as a competent professional. The fear to approach for feedback lies in everyone's mind. You are scared of negative feedback. The feedback needs to be given and received in a true spirit. Hence, we should understand how to receive feedback and how to give feedback whenever asked for. Feedback should be given as a gift, which all of us always like. It should be given with permission. Intention is growth of a student. It is given for you and it is not about you. It is always targeted for your success. In a typical old pattern of giving feedback, your teacher may follow these steps called as constructive criticism. Teacher will begin with some positive comments. Teacher will praise you for positive points in you. You will be complimented for good things. Teacher will then point out at your negative points and it may sound to you like criticism. Care will be taken to point out your strong points. Support is offered in areas of improvement and the feedback session ends with a positive note. It sounds like you had a huge burger or a double-decker sandwich. However, at times the constructive criticism may sound like this to you. Will you ever like such type of feedback? Definitely not. Hence, a better method of giving feedback is now adopted. In this method, you as a student would be asked to reflect on your performance. As an adult, whatever may be the circumstances, there will be some positive points with you to narrate. When teachers tell you about the areas of improvement after pointing out the lacunae which were observed, teacher then asks you about how you can overcome the challenges and how the self-development can be done in similar such situations or worse situation if arises again. You as an adult learner should be able to seek benefits of effective feedback mechanism in your professional journey. Friends, let us now summarize this session with some key messages. Education in modern medicine has evolved in India over last 200 or more years. Good practices from modern medicine and Ayush education needs to be mutually shared. Competency-based medical education, which is outcome-based, is getting established in our country. The new curriculum in modern medicine is student-centric and is incorporating adult learning principles. Some of the newer components of CBME curriculum would be relevant and feasibly applicable in homeopathy education. So this is the journey of modern medicine education in our country. We witnessed various aspects of how modern medicine import in our country resulted in development of modern medicine education in our country. We saw various aspects of new curriculum that is being implemented from 2019 in our country by National Medical Commission. What are the aspects of this curriculum? What is the meaning of the word competency? And we also narrated all the aspects of various principles of CBME curriculum. We learned important aspects such as early clinical exposure, and also we learned about various adult learning principles. You as an adult, through your peers, you are going to enjoy the learning of the first professional year of homeopathic education. These are resources for you as additional learning, and these are the references for you to refer. My acknowledgements go to National Homeopathy Commission New Delhi, National Medical Commission New Delhi, Maharashtra University of Health Sciences Nasik, and Department of Medical Education, St. GS Medical College and KEM Hospital, Mumbai.